Looking to quit smoking? Varenicline might be the answer you've been searching for. This medication, commonly known by its brand name Chantix, is used to help individuals stop smoking. In this comprehensive video, we will explore the common indications, dosing details, side effects, and user feedback associated with Varenicline. Varenicline works by blocking nicotine receptors in the brain, reducing the pleasurable effects of smoking and easing withdrawal symptoms. By targeting both the addiction and the urge to smoke, it provides a dual approach that increases the chances of successfully quitting. We'll delve into the various conditions Varenicline is prescribed for, including its effectiveness in quitting smoking, reducing cravings, and managing nicotine withdrawal symptoms. You'll also discover important dosing details and guidelines for taking this medication. Of course, like any medication, Varenicline does come with potential side effects. We will discuss these in detail, ensuring you have a full understanding of the possible risks and precautions before starting treatment. Additionally, we'll provide real-life user feedback to give you insights into others' experiences with Varenicline. Join us as we explore the multifaceted world of Varenicline and discover if it's the right choice for you on your journey to a smoke-free life. Common indications for Varenicline. Varenicline is primarily prescribed to aid individuals in quitting smoking. It is approved for use in adults aged 18 and older. Quitting smoking has numerous health benefits, including reducing the risk of heart disease, lung cancer, and other smoking-related illnesses. Varenicline is especially helpful for those who have struggled with previous quit attempts or have found it difficult to quit cold turkey. In addition to smoking cessation, Varenicline may also be prescribed for other nicotine-related disorders, such as smokeless tobacco use. It can help individuals overcome their addiction and reduce cravings, ultimately leading to a smoke-free lifestyle. However, it is important to note that Varenicline should only be used as part of a comprehensive treatment plan that includes behavioral counseling and support. Dosing details for Varenicline. When it comes to dosing Varenicline, it is essential to follow the prescribed regimen provided by your healthcare provider. Typically, the recommended starting dose is 0.5 mg once daily for the first 3 days, followed by 0.5 mg twice daily for the next 4 days. On day 8, the dose is increased to 1 mg twice daily. The duration of treatment may vary depending on individual needs, but it is generally recommended to continue Varenicline for 12 weeks to maximize the chances of successful smoking cessation. It is important to take Varenicline with a full glass of water after eating to minimize the risk of nausea. If you experience any adverse effects or have concerns about the dosing schedule, it is crucial to consult your healthcare provider for guidance. Potential side effects of Varenicline. Like any medication, Varenicline does come with potential side effects. It is essential to be aware of these before starting treatment. The most common side effects reported by users include nausea, headache, insomnia, abnormal dreams, and changes in taste perception. These side effects are generally mild and tend to resolve on their own as the body adjusts to the medication. However, it is important to note that Varenicline has been associated with more serious side effects in rare cases. These include changes in behavior, mood swings, depression, suicidal thoughts, and even suicidal behavior. If you experience any significant changes in mood or behavior while taking Varenicline, it is crucial to seek immediate medical attention. User feedback and experiences with Varenicline. Real-life user feedback can provide valuable insights into the effectiveness and tolerability of Varenicline. While individual experiences may vary, many users have reported positive results and success in quitting smoking with the help of Varenicline. They have highlighted the medication's ability to reduce cravings and ease withdrawal symptoms, making the process of quitting more manageable. Some users have also mentioned experiencing mild side effects, such as nausea or vivid dreams, but these were generally well tolerated and did not hinder their progress in quitting smoking. It is important to remember that everyone's experience with Varenicline may differ, and it is crucial to consult with a healthcare professional to determine if it is the right choice for you. Precautions and contraindications for Varenicline. While Varenicline can be effective in aiding smoking cessation, there are certain precautions and contraindications to consider before starting treatment. It is essential to inform your healthcare provider about any existing medical conditions, such as psychiatric disorders, kidney problems, or a history of seizures. They will be able to assess whether Varenicline is suitable for you or if alternative treatment options should be considered. Additionally, Varenicline is not recommended for use during pregnancy or breastfeeding, as its safety in these situations has not been established. If you are planning to become pregnant or are currently pregnant, it is crucial to discuss your options with your healthcare provider. Alternative treatment options for smoking cessation. While Varenicline is a commonly prescribed medication for smoking cessation, it is not the only option available. There are alternative treatment options that may be more suitable for certain individuals or in specific situations. Nicotine replacement therapy, NRT, such as nicotine patches, gum, or lozenges, can help reduce cravings and withdrawal symptoms. Bupropion, an antidepressant, is another medication that has shown efficacy in smoking cessation. Behavioral counseling and support groups can also play a significant role in helping individuals quit smoking. Combining medication with behavioral interventions has been found to be the most effective approach in achieving long-term success. Frequently asked questions about Varenicline. Can Varenicline be used by heavy smokers? Yes, Varenicline can be used by heavy smokers. It is effective in reducing cravings and withdrawal symptoms, regardless of the amount smoked. Can Varenicline be used in combination with other smoking cessation methods? Yes, Varenicline can be used in combination with other smoking cessation methods, such as nicotine replacement therapy or behavioral counseling. Combining different strategies can increase the chances of successfully quitting smoking. How long does it take for Varenicline to start working? Varenicline starts working within a few days of starting treatment. The gradual increase in dosage allows the medication to build up in the body and effectively block nicotine receptors in the brain. Are there any drug interactions with Varenicline? Varenicline may interact with certain medications, such as insulin or theophylline. It is important to inform your healthcare provider about all the medications you are currently taking to avoid potential interactions. Conclusion and final thoughts on Varenicline. Varenicline, also known as Chantix, is a medication commonly used to help individuals quit smoking. It works by blocking nicotine receptors in the brain, reducing the pleasurable effects of smoking and easing withdrawal symptoms. With its dual approach in targeting both addiction and cravings, Varenicline increases the chances of successfully quitting smoking. Before starting Varenicline, it is important to consult with a healthcare provider to determine if it is the right choice for you. They will be able to assess your medical history, discuss potential side effects, and provide guidance on the dosing schedule. Remember that Varenicline is most effective when used as part of a comprehensive treatment plan that includes behavioral counseling and support. While Varenicline has shown positive results for many individuals, it is important to be aware of potential side effects and seek medical attention if any significant changes in mood or behavior occur. Everyone's experience with Varenicline may differ, and it is crucial to find the right approach that works for you in your journey to a smoke-free life.